we need to revisit. I'd like to come to you, Ruth. You're a peer educator, you say. And I believe as a peer educator, or should I say as peer educators, we tend to interact with a diversity of young people. We get to understand their challenges, we get to empathize and sort of see what they're going through, but also speaking as a young person. I believe Original has spoken on a number of issues, and some of them cut across for all young people. But I'd just love for you to add your voice. As a peer educator, over the past couple of years when we've been having the pandemic, what key issues are you seeing that have arisen? What key SRHR issues are you seeing that are really affecting young people? And also, do you see a change between when we had the first outbreak and now? Do you think we are doing enough? Do you think something is being done? Do you think that our stakeholders are sort of taking charge of the situation and trying to, come in and remedy those challenges?
Oh, yes. Thank you very much for that question. Yeah, I feel like we, including the NGOs, the communities themselves, and then our leaders, the politicians, I feel that we were more prepared for the second wave, for the second lockdown, than the first one. We knew our way around, we knew how, we needed to get things done. But of course, you cannot forget that there are those people who didn't know how to, get anything done. For instance, I can say one of the challenges that I know we are facing as young adults in relationship to sexual reproductive health and rights is that you find a young teenager, HIV positive like me, and they are struggling to access ARVs during lockdown. And during this recent lockdown, when it had just kicked off, I remember there were police roadblocks where they were asking people to give the reason as to why they were leaving home to move. Now, in a scenario where I am going to hospital to pick my ARVs, I am forced to disclose my status, which is something I don't want to do. So it's more of like violating also human rights, our health rights. How about the government would have given us maybe a week or two to prepare before we go into lockdown, rather than, just snap a finger and then boom, we're in a lockdown. How about before we go in a lockdown, if much as we give out condoms for free, we can also give out pads for free, because we all know NBS has been showing these special stories. I mean, from Kanare Mugume, where people are giving, the young adults are giving sex for pads, and then the one from yesterday for Daniel Lutaya, where children are being trafficked, from Karamoja. They're taking shortcuts, to go make money because, things are tough. And then the question remains, after you have crossed over from one place to another as a trafficked child, for the female, how are you going to deal with the issue of, you need sanitary towels in a situation where you're raped, in a situation where you need medication? So we need to pay attention to the small details. It's not always the big things that really do matter. And maybe to add to Original, he spoke about the fact that people living with disability are facing a double challenge. And it's even worse if you're living with a disability, at the same time, let's say you're living with HIV, at the same time you're coming from a vulnerable family, like literally all the guns are pointed to you and you don't know what to do. So we can keep doing this, year in, year out, month in, month out, keep talking about these issues, keep, putting flyers out on social media, complaining, telling the government to make a change and this and that. But it comes down to one thing. We need to act. We need to speak less and let's act. Yeah.